Hi, my name is David Lee, and I'm the founder of Intervention Services. And this is the part of our website where we actually provide a little bit of education or information about the various interventions that we do. And today I'm going to be speaking about a crack cocaine intervention, or a crack intervention, or an intervention done on somebody who uses and abuses crack cocaine. Again, my name is David Lee, and I'm the founder, but I'm also a recovering drug addict, and I have a lot of experience, as a recovering addict with a lot of the different drugs that I'm going to talk about in these sections. So generally speaking, we get a couple different types of phone calls from people who are looking for help for somebody that's abusing crack cocaine. The majority of the calls that we get are generally from somebody who's between the ages of 30 and 40. They may have had drinking issues or things like that in the past, and what happens is they experiment with cocaine. They usually progress over to crack cocaine, and more often than not they become what we refer to as a binge crack cocaine user. Realistically, there's two different types of crack cocaine users that we do interventions for. There's the binge user, who may or may not be able to stay sober for days or weeks or months. They get a little bit of money, or some life event happens, or they get a job or lose a job, get in an argument with their wife or whatever have you, and they go out with every intention of just having one or two rocks, if you will. And it's Friday, and they make it home by Saturday. As their progression increases, they go out on Friday, they come home on Sunday. Their progression increases, they go out on Friday, and they get home on Monday or Tuesday. The addiction itself gets more and more intense and more powerful as time goes by with each successive drug use. It is not uncommon for a drug user or a crack cocaine user to rent their cars out for drugs to total strangers, to sell their possessions, to sell their family's possessions. Binge crack cocaine users are very difficult for families to intervene on, because they can be fine for a while and then they're not fine. They're fine for a while and they're not fine. And the family ends up kind of held hostage with these binges. And all they want more than anything in the world is for the drug use to stop. So that's one particular type. Another type, which is more rare, is somebody that uses crack cocaine on a regular basis to function. In other words, they wake up in the morning and they use crack cocaine. We don't see very many of these types of crack cocaine users, because crack, although it's relatively cheap, it's about $10 for a very small amount. And that may last you, depending on where you're at in your progression, it may last you anywhere from 20 minutes to a couple hours. The problem is that the withdrawal of the drug, which happens almost immediately, becomes more and more intense. So if they experiment with drugs and they're 18 years old and they use crack cocaine, the withdrawal is relatively mild compared to fast forward 10 years from now, where it can be very, very intense. If I were to use crack cocaine today, the withdrawal for me would be excruciating. Not necessarily physically excruciating, but psychologically. I would do absolutely anything and give away absolutely anything for another hit. So crack cocaine intervention, generally speaking, we try and time it for the binges. Generally speaking, we can kind of predict when somebody's going to go out on a binge, when they're going to use, and ideally, in a perfect world, we're going to do the intervention once they get done with it. Part of the withdrawal effects of coming down off of crack is major depression, clinical depression, etc. People are more receptive to accept help when they're down in the dumps. The worst possible time to do an intervention on a crack cocaine user is payday, when they have a bunch of money, or money that is coming in. Maybe they're waiting for a disability check, or maybe they have a settlement coming in, or a 401k or something like that they're going to cash out. It's almost impossible to get somebody to agree to go to treatment. However, generally speaking, over 90% of people that are intervened on that are crack cocaine users actually do enter into treatment. So this is just an opportunity to give you a little bit of background about crack cocaine and the interventions that we do involving it. We can be reached at our website at any time, which is www.interventionservicesinc.com. And you can ask to speak with any of our intervention coordinators, or you can even ask to speak to me directly, David Lee. Thank you very much.